Good afternoon. Thank you for attending today's meeting. I believe that we're just waiting for a quorum, so we're waiting for one or two additional people. So I appreciate your patience. Thank you for showing up. Okay, I think we're going to go ahead and get started. So thank you so much for attending today's task force to study the methods to address the shortage of radiologic technologists, nuclear medicine technologists, and respiratory care practitioners in the state, and to develop a plan to address such a shortage. So this is our third meeting of the task force. I am one of your co-chairs. Matthew Green is on as well. He is as another co-chair as well. So we're calling the meeting to order. Just a review of the charge. We are charged with reviewing the workforce development issues for radiologic technologists, nuclear medicine technologists, and respiratory care practitioners. And a report to the Public Health Committee is due January 1st of 2025. So thankfully, Mr. Kidwell is here on time. Hopefully we'll be able to get our initial report. So we're set up to do some reporting out of the committees. I know that Mr. Kidwell, you were challenged last time with having to be able to obtain the vacancy rates for our facilities in the state of Connecticut. How are we doing today?
Yeah, so thanks and good afternoon, everybody. Appreciate seeing all you. I was able to speak late last week with Representative McCarthy Vahey as well, because she was reaching out to OLR to see if they could get some additional information. And I think if you recall the last time we spoke, what we surveyed was a more general a list of job descriptions, and OLR, they were looking into whether OLR could provide additional information. So I spoke with Representative McCarthy Vahey, who extends her apologies. She wasn't sure if she would be able to make today. And she had an initial discussion with OLR, who said that they would likely just come to us for the information. And so we felt like we were going to get in sort of just a loop. And so what I discussed and what I wanted to talk with you all about was expanding the survey instrument that we were using with our members to provide more detailed information listed in the agenda. That's not something we had surveyed yet. Again, it was broader list of descriptions, but given there's an interest in more specific, we would, if everyone's agreeable, send out a survey probably next week to our members with this additional request for information, and then be ready to bring that back to everyone, I think, in our October meeting. So apologies, I don't have, but it was sort of late breaking with OLR, and it didn't sound like they'd be able to provide the level of detail that we were hoping.
Okay. Thank you. Thank you very much. So you'll get that information to us?
Yeah, so I think what we were planning on doing was then using this, on the agenda, we have a much more specific list of job descriptions. And so we would use that to survey the hospital members, asking both for their inpatient and outpatient, if they are able to actually delineate by location, and then bring that back and get that to the members of the group.
Okay, thank you very much. I appreciate it. All right, so Mr. Green, nuclear medicine is the next report.
All right, let me just share the screen so I can stay on task. Can we see this?
Yes.
Okay. So yeah, like in the last meeting, I talked about there's only one program in Connecticut, and unfortunately, I reached out multiple ways to the program director. She was not responsive, so I don't have any information from her on her ask or on her numbers or what she's seeing. So I surveyed my areas that I oversee in the medical imaging at the hospital I work at. So these are some of the things that they, using your heading, state actions to attract new people. So a lot of what we found was from our technologists that there's sort of a lack of awareness of what they do and how they get their training. A lot of them brought up, you see people in hospitals, the broader public kind of think of nurses and doctors. So they were kind of saying, even in their career paths, they fell into it, by knowing someone in the path, getting a mother, father, cousin that works in imaging or other modalities or respiratory therapist, that it's not really a path that's known, but there's a lot of jobs out there for people. So their thing was, why don't we see more marketing to both the public, and then the second part of this is the high schools and high schoolers and tech programs about these pathways to get into schools and get into these career paths. At Manchester Hospital, one of the hospitals I work at, we do run a program now with a school in the area. We run it once a year. They bring a class of about 20 in, and all the technologists show them around, show them what they do, kind of enlighten them to this career path. But this is a big haul. This is, it takes a lot of effort to create these programs. So they were saying, the management and even the technologists on the floor saying, if you can expand this program, build it up, which would require funding. So those are those ideas for attracting new people. And then the infrastructure assistance, I think, is kind of going to be a lot of the same, but they do have some ideas, tuition waivers, loan forgiveness. One of the big things is we run a big teaching site at Manchester Hospital, and we employ a student coordinator that works with the schools in the area. Again, it's a big ask, and it's a big thing for us to bring all these students in. So getting new teaching sites and then expanding them sometimes isn't in the fiscally purview of the sites. And then also talking to them, retention and relocation program as a hiring manager, and then talking to them too is not just outside of the schools. I think we kind of always go down that path of let's expand our schools and how to get students and, from Connecticut. We do see people outside of Connecticut that always ask for, does the hospitals provide for relocation? It's something that we think maybe the state could step in and help with a funding or legislature that, could help people that want to relocate to Connecticut and keep them here. Moving, so like tax breaks, and then funding for that marketing we were talking about.
Thank you, Mr. Green. I'm going to go ahead and I'll give the report out for the radiologic technologist in the state. So just pardon me while I just get my screen sharing. Okay. Okay, so I had the opportunity to send out questions, and I did get a 50% rate of return. So in addition to getting more information about what is needed in the state and some feedback on state support as well as the infrastructure, I did reach out to the state society, the Connecticut Society of Radiologic Technologists, the legislative committee members specifically. So there are 8 programs in the state. So currently the questions that were posed had to do with understanding the shortage. There were 4 questions in that category. There were 4 questions related to program capacity and resources, 4 questions related to support from the state, and then 2 related to future planning. So like I said, there are 8 JRC accredited programs in the state. The 4 responses from the programs were received from those program directors, and there were multiple comments that were put forward by the legislative committee. Sorry. So the first out of the results, when we talk about understanding the shortage of these 4 program directors and the CSRT The current challenges that they have are that the adult learners are having issues with the work-life balance with the demands of training and education on a full-time basis. The cost of education is not always attainable through the programs in the state, as well as the students that are seeking these professions. Application numbers exceed the capacity, so we're having an opposite problem as to what the nuclear medicine profession is having, is that we have many people that are interested. We just don't have enough room at our teaching institutions as well as our clinical sites to be able to train and teach them. And then the academic preparation of the students that are incoming, especially with those that are coming out of the COVID era, there is a need to work at improving our retention rates as well as our first-time pass rates. Graduation rate, though, we have maintained pretty stable across the 4 institutions that did respond, averaging about 85% over the 5 years, and they're not affected by the external factors. Enrollment trends, there's no decline in enrollment. They've actually doubled in size compared to prior years, and there is a wait list at many of the programs. And the industry demand, there's high demand nationwide for our professions, and students are often employed with multiple offers prior to graduation. So with capacity, many of the programs state that they are at or above over capacity. Most of that is due from pressure from administration at these higher education institutions to exceed capacity due to financial pressures. With our clinical training, our sites, unfortunately, with the competition of the eight programs in the state, they are unable to accept more students. They have their own staffing shortages, and there's pressure to place them in multiple programs. Our accredited programs require a 1-to-1 ratio, so that's tech to student. So as you can imagine, with staffing shortages, that makes it more challenging for them to accept. Faculty needs at the programs, there's no issues that are recruiting quality faculty. The more faculty is not necessarily going to impact your program capacity. Pay for educator is traditionally lower than in industry. So those of us that love to teach are teaching for a reason, not necessarily for the pay. And our specialized field, because we are so niche, requires higher education to be able to teach at these levels. And technological resources, I was glad to see that the programs that did respond state that they are up to date at most of our programs with energized labs that are on site at their facilities. With the support from the state, they stated that clinical placement assistance would be appreciated, financial support and incentives for the facilities, as well as financial incentives and supports for technologists and therapists to accept more clinical placements. State-provided scholarships, loan forgiveness programs, loan waiver as well, tax relief, incentives, home buying assistance, rental assistance, so affordable housing for anybody that is attending school in our states to be able to stay here, and acknowledgement from the state as it relates to respect for the profession. Some incentives for students is, again, state-provided scholarships, loan forgiveness programs, tax relief incentives, and affordable housing. So with our partnerships with our healthcare providers, we would like our healthcare providers to be able to develop programs that will help to incentivize our clinical placements, such as providing funds for therapists and technologists to be able to pay for their continuing education, because they are expected to be able to keep up in the profession with continuing education in exchange for placements. Some legislative changes we would like to see a change in the professional licensing fee structure that's provided currently by the Department of Public Health. The initial fee for a radiographer licensure in the state is in line with an audiologist and an APRN professions. So that's about $200 for the initial fee. And then we do have a lower annual cost. For future planning for long-term solutions from the 4 schools and the legislative committee of the CSRT, they would like to see, again, the lower initial cost of state licensure to be in line with professions with the same level of education and training. Monitor and ensure other professions do not encroach on the scope of practice for radiography. Improve the starting salary to be in line with the cost of living in the state. Some innovative approaches so our profession has a radiologist assistant ladder. So we would like to advocate for the radiologist assistant profession in the state, so that helps to support the career advances rather than a lateral move within our field. And this also not only helps to support our technologists from staying in the state and advancing in the state, but also helps to support the shortage of the radiologists in the state. So some next steps or recommendations to attract new people or to retain our current technologists, so what I would like to do is to send out a compilation of the results to program directors in the state society to identify the top 5 recommendations of support from the 4 topic areas. Present those recommendations at the October meeting for review and discussion in a final report. Draft our final report at the November meeting for distribution among the members, and then we have to submit to the committee by January 1st, 2025. Okay. All right, so that was my report for the radiologic technologists. So I believe I have Ms. Griffiths and Mr. Sajad that will be reporting out for the respiratory care practitioners.
Okay, can you see my screen?
No.
Okay, hold on one second. Sorry.
That's okay.
Okay, is it working now?
Yes.
Okay, so Sajad and I, we sent out the survey to the program directors of the educational institutions in the state. We also sent out a modified version to all the hospitals and the managers of the respiratory departments in the state. And we had a pretty good return rate for the program directors. There are 6 respiratory programs in the state. 5 entry level and 1 degree advancement. We received 6 back, so we had over an 80% return rate. And for the hospital managers and directors, we actually sent it to the co-chairs of the CHA, the respiratory CHA, and asked them to forward it to any hospital managers hospital managers and directors. And we received 6 back, but we think we got a pretty good sampling. We had one back from Hartford Healthcare, the director of Hartford Healthcare, Yale New Haven Health, Danbury, Nuvance, and then some smaller hospitals as well, Lawrence and Memorial, and we had one from Bridgeport. So we had kind of a sampling of different areas in the state and different size hospitals. So some of the results we had, the way we have this presentation is, I wrote who were answering these questions. So understanding the shortage, some of the challenges that the hospital managers and directors saw. And their challenges was there's a great demand for graduates. There's not enough applicants, so they don't get enough graduates to fill their seats to keep up with the workforce demand. Summarizing the many different ones we got, the pay, many of them reported pay being a big issue in the field, not keeping up with other professions such as nursing. One particular survey talked about having a difficult time keeping up with pay with border states because that particular program, or a hospital rather, was close to the New York border. Many of the surveys talked about how the employees will kind of bounce around jobs looking for the highest pay or work multiple per diem jobs instead of a full-time job. There was talk about not enough staff to take students or compensate preceptors, kind of like what Bernadette was talking about with radiology technologists. If there's such a shortage, it's really hard for those hospitals to then train students. And they're filling a lot of the spots right now with travel therapists, and there's a lot of concerns with that. They're very costly, frequently not experienced enough. So those were some concerns that they had. And then understanding the shortage, this is from the perspective of education program directors. And, there's a lot of overlap, great demand for new graduates. So both are seeing that. The graduates are having no issues finding employment. Most of the survey said 100% graduates finding employment within the first years. Other ones were very close to that. There were comments that, such as Bernadette put on, that most of the graduates had multiple job offers prior to even graduating. So that part wasn't an issue. The issue is, and we talked about this at the last meeting, the difficulty filling the seats. And I have the chart I put up last meeting. I have it on the next slide as well. I'll show that quickly again. But the chart shows 59% average of all entry-level programs. So the 5 entry-level programs between 2020 and 2022, there's about a 59% average of filling the seats. And so the challenges that education program directors felt was a lack of awareness of the profession. So similar that we're seeing with nuclear medicine, that people don't know about the respiratory profession. Also, there was other issues about the cost, financial aid availability. Specific comment from the one associate to bachelor program, so not an entry-level program, but a completion degree, was that they felt there was a tuition barrier, that the state online school had a higher tuition than other online programs nationally. So respiratory therapists who have associate degrees that are pursuing that bachelor degree many times aren't going to the one Connecticut state school to do that. And then other comments about prospective students choosing other professions that have a higher salary. And then again, this is just the same chart I put on last meeting, but it talked about, on here is the 6 programs. The Southern is the one completion degree, AS to B or BS program. And so I didn't count that as making new therapists. For the 5 that are creating new therapists in the state, there's a 59% average enrollment from 2020 to 2022, which is the numbers that are published with our accreditation. So then going to program capacity and resources, and this was from the perspective of the respiratory education program directors. The program capacity, all the programs that answered the survey talked about the COARC accreditation standards, which is the respiratory accreditation agency. And that says that programs cannot go above 10% capacity without making substantial accreditation changes. Not that they wouldn't be willing to make those substantial accreditation changes, but they can't do that without doing that. So one of the biggest challenges are the current seats aren't being filled. So they can't really justify having going up on the capacity without having the current seats filled. And then if the program was expanded beyond the 10% and there was substantial accreditation changes made, there would be a need for more space, additional faculty, and clinical placements. And then as far as clinical training, with the shortage of respiratory therapists and the high use of respiratory therapy travelers around the state, hospitals frequently cannot accept students with staff preceptors. And for respiratory education, the ratio can be a little bit higher, but the 2 models of education in the state of Connecticut are preceptor educations, where a hospital staff takes a student and trains them for the day, and also adjunct clinical placement, where a college or a university hires an adjunct clinical instructor who has rights at that hospital, and they take the student for the day. They're both costly to programs, but hiring an adjunct clinical instructor is much higher cost and becomes a financial challenge for many programs. In addition, with the clinical training, some programs reported that transportation to clinical sites is an issue. For the field of respiratory, we have to train our students in the intensive care unit, so they have to go to a major hospital that has ventilators. And so many times that's a pretty significant travel to that hospital. I can speak for University of Hartford. When we're sending students, we'll send them up to 1 hour and 15 minutes away. And that's while they're taking classes on different days of the week. So that can be a challenge. And then faculty needs. Most of the programs reported that they are not currently having faculty issues, but there has been in the past, and many times it's due to the degree requirements that is needed for the faculty. So to teach at an associate or a bachelor level program, you have to have a master's degree. And then to teach at the doctorate program, you have to have to teach at the master's level program, you have to have a doctorate degree. And with respiratory therapists, the entry level degree being an associate, and we're finding that there are not enough therapists who are going for those higher level, higher degrees. And that's something we'll address later on as well. So resources, most of the programs felt that they had appropriate resources, but the equipment is costly, and they always look for ways to help with the cost, whether it's through grants or donations. And the cost of clinical instruction is high. I know for our program, it's probably one of the highest costs that we have for our program. So creating partnerships between healthcare providers and respiratory programs. And I put these both, I put the comments from the managers and directors from the hospitals on the same slide as the education program directors, because there's a lot of overlap, and I thought it would be useful to see this on the same slide. So if we start with the managers and directors from hospitals, they said that exposure to hospitals during programs help create a pathway to employment. There's such a shortage that they want to have the students. They want to have the clinical rotations. Many of them have created things such as equipment positions, student equipment positions, because then if they hire a student to work in their respiratory equipment position, they can then maybe continue on and get a job as a respiratory therapist. Some have internships too, where it's not their clinical instruction, but it might be a 2-week paid internship to give them further exposure. And they find that this is helpful because then students may be more likely to work at that hospital. And then one comment, and I thought this was important, talked about how the hospital felt the need that the programs allocate the clinical hours to all hospitals that want to take students evenly. And they felt that this was a fair way to attract prospective students because of what we've been talking about, that student exposure increases the chances for the hospital recruiting to those sites. From the educational program director's perspective, they felt like a partnership that helped provide incentives such as increased wages to encourage staff to be preceptors for students. With the shortage, it's very hard. A lot of staff don't want to be preceptors. So having some types of in-services, some type of incentives, and also career ladders, and being a preceptor being part of the career ladder. They felt it was important to encourage staff for degree advancement. And this helps fill those roles, not just of future educator roles, but also for managers of departments and leaders within the department. So providing tuition assistance for helping current respiratory therapists advance their degree. And then having respiratory therapists at internal career fairs. From the surveys, some programs are doing this and other programs want to do this. So going to the hospitals when they do internal career fairs to try to promote the profession for people who may want to advance to a different type of profession, such as respiratory. And then Sajad's going to talk about the next couple of slides.
So these are just some ideas that we kind of took from the managers and the director from one of our hospital departments, specifically Hartford Healthcare. Tuition assistance, student loan forgiveness to encourage students to enter and stay in the profession. That would help for entering respiratory therapists to stay in the state for a certain amount of years. It would become a requirement, because one of the things that we are noticing is that therapists, I think I mentioned this at the last meeting, is they obtain the minimum amount of experience, which is usually 1 year, and then end up applying to travel or other positions that offer higher pay after getting that 1 year of experience, which is, that's cost intensive for the hospital, for the department, because of the hours and money it takes to train. Other ideas include state-hosted and advertised healthcare career exploration fairs, grant funding for marketing of the profession. I think that those two are very key because, like we said earlier, there is very little visibility for respiratory therapy. We did have a little bit of a spotlight during COVID, but not since. I don't think. Our rather interest has kind of waned. State support for career advancement and growth opportunities in the field, meaning tuition assistance for current RTs to get advanced degrees, such as their bachelor's or master's. Potentially support for an advanced practitioner respiratory therapy program as well. Support for limited licensure for students to work prior to graduation, similar to Massachusetts. We have had in the past at Hartford Hospital, particularly, we have had a few students during the pandemic who were granted temporary licensure as students to work. And I know that a few of them did end up staying, but again, because of the pay that was offered elsewhere, ended up leaving, unfortunately, after about a year or so. Relocation or incentivized support to attract respiratory therapists to less populated areas of the state. I think we did receive some feedback from a few of the hospital directors in those areas of the state where I think that is a big concern they were having. Karen, correct me if I'm wrong, but that did seem to be something that was brought up.
Yeah, especially in the smaller hospitals and not in not as urban areas, they felt that they were getting less applicants because they were in more rural areas. So they felt like if we could somehow incentivize people to respiratory therapists to want to work at the smaller hospitals.
And I think one of the other issues with that is those areas then have to attract more travel respiratory therapists, which is again another cost to a smaller facility, which is probably not something they can do as well as a bigger facility. Then also incentivizing RTs from bordering states to work in Connecticut. That would be something along the lines of like a cross-state or interstate licensure program, where if you obtain licensure in one state, such as Connecticut, then that would let you work in Massachusetts or Rhode Island or something like that. That would be something that we could look or suggest. Additional ideas, assistance for competitive salaries. I think the margin is getting closer between hospital staff and travel staff, but there is still a significant, I guess, difference, so to speak. It is getting better, but it's not there yet, I don't think, because we still have people who are applying to travel programs actively. Opening additional respiratory therapist programs in part of the state, the eastern side and closer to Bridgeport, closer to the New York area as well, New York, Connecticut border. Creating pathways for professions that may want to advance in the healthcare field, such as medical assistants, CNAs, paramedics, EMTs, and bridge programs for LPNs or paramedics. I think that is definitely something that would help boost, I think, the ranks in any healthcare field, especially respiratory, because there is a level of cross-training that takes place just by working in those fields already, between like them and respiratory care. Child care assistance, availability of public transportation to assist with students to complete their degrees. Even something as simple as like parking, paying for like parking garages and stuff like that, I know can be a huge help. I had students last week that kind of mentioned that. State support for partnerships between healthcare providers and educational programs. Need for minimal staffing levels and patient ratios. I know the nursing lobbying groups are working on this in Connecticut, trying to mimic the programs or the laws in Massachusetts, California. Support for protocols and higher autonomy, and support for our advanced practitioner respiratory therapist programs.
So the same question, or the same ideas for managing shortage, but from the perspective of respiratory education program directors, a lot of similarities: tuition assistance, student loan forgiveness to reduce financial barriers, financial incentives for hospital respiratory departments to train students as preceptors, assistance with competitive salaries to entice prospective students to go into the profession, support with licensure fees, support with community outreach and hosts in particular, assistance with innovative partnerships with hospitals, faculty support, possible support with equipment, and marketing assistance, creating a video. Specifically, one person wrote, creating a video about the profession they felt would help. They could share that at different events. And then the requested legislative support, so putting everything together, you know, trying to get listening to everyone, the program directors, the hospital managers and directors and leaders in the state. Loan forgiveness could really help students go into the profession, since one of the issues is filling the seats, and we really need to get more students in the seats, the grant money. And this was really kind of looking at some of the things that that happened with the Horizons initiative for nursing in 2022. So kind of doing something similar to help with respiratory, such as tuition assistance, faculty support, innovative programs to promote partnerships between healthcare employees and institutes of higher education. And some of those are some of the things that we had talked about with the ideas from both hospital managers and program directors. So encouraging RT internship programs and partnering programs, support for clinical preceptors, supporting an RT advancement or career pathways, bridge programs. And then other ideas to help improve the visibility of the profession. And this might be for high school students, prospective students who want to go into healthcare. But as I think it was Matthew that said, a lot of people don't know about some of these allied health professions. And I put respiratory in that category. So supporting trying to increase the visibility of and the awareness of this really great profession. And that could come in career fairs, possibly coordinating with HOSA, since there is already HOSA chapters with students who are interested in healthcare. Grants for retention bonus to work full-time after a certain amount of years. And again, that a lot of times it was happening because of so many people doing per diem, trying to get the most pay they can get. They're working per diem at multiple hospitals. So trying to get more therapists to do full-time work and stay at one hospital for longer. And then support for billable interventions and insurance reimbursement. Funding for marketing, billboards, radio ads, and then compact licensure, support for compact licensure. And that's, if we have respiratory therapists who are on border states, that we might be able to attract people from Massachusetts or New York to come work at Connecticut hospitals. And then we didn't have a timeline like Bernadette did, but I did like that. And I would say that timeline kind of makes sense for us as well. And we certainly want to have, but it's putting together all of our recommendations or official recommendations within that timeline. So thank you.
Thank you very much. As always, very comprehensive, and I enjoyed it. I'm going to open up for discussion right now. If I can start, if no one else has anything right now. I wondered regarding both for nuclear medicine and respiratory care practitioners. So I discussed how the radiologic technologists do not have an issue right now with recruiting, right? So we have an overabundance and overcapacity and a huge interest. And a lot of that is on part because of our national society. So there's a new campaign that they're running. It's called #BeSeen. So that is a national campaign that the American Society of Radiologic Technologists has been running to put the word out about who we are and what we do. Is that something that your national society would be open to doing? Matthew, I think that includes for us. I think you're included within that for nuclear medicine.
Yeah, we get lumped in with you guys.
So, Ms. Griffiths, Mr. Raza, what do you think?
Do you want me to speak? So there is a national campaign. It has been going on for a couple of years. It's a partnership between the 3 respiratory organizations, the American Association of Respiratory Care, NBRC, which is our testing agency, and COARC, which is our accreditation agency. And they've been putting out this campaign because they know the shortage is not just in Connecticut, it's nationally. So they've had this campaign it's been a couple of years now. They've revised it a little bit this past year. It's called BNRT. And there's lots of videos on respiratory therapists in the profession, and there's information. And last year they had a big social media where they were encouraging and giving you little rewards for prospective students, for people working already in the profession, to put out these social media campaigns. It's not enough. So yes, we are working at it with our professional organizations, but it's not enough. And I think, how I've always looked at it, respiratory therapists is very unique. Anyone who works in a hospital knows about respiratory therapists. All the studies show how important they are and how it improves patient outcomes, especially when you're looking at critical care. But because it is a lot of critical care, I don't think high school students always know about it unless they know somebody who is in a hospital. Where some of the other professions and even radiology technology, you may have had an injury at some point, or you may have known someone who had an injury and you needed an X-ray or an MRI or an ultrasound. So it's a little bit different in that regard. And so we do need a little more assistance with marketing and visibility of the profession.
Okay. Any other questions or comments?
I'm just curious if there's some opportunity for collaboration in terms of nuclear med and nuclear med techs and radiology techs, just because if it seems on one end you have an excess of people that want to go into it, still leading to a shortage, but there's at least an excess of people want to go into it. Maybe they just don't know that nuclear medicine, which is a similar but different job, that is available to them, if that would offload some of the excess of people that are trying to get in. I'm still it's unclear, how, I guess, where the shortage is really coming from. There are a lot of people that want to go into it. It's just we don't have enough spots to generate the number of techs that we need to perform radiology in the state. Is that your general feeling?
Yeah, it's kind of like the chicken and the egg, right? So we have all these people that want to be in training. They want to be in a program, but because of the shortage, there's not enough people to train them in the field. And I think that's what we're running into right now with all of our professions, is that we have people that are interested, but there's not enough people to be able to train them. So that is the holdup. That's the bottleneck on the radiologic technologist side. 8 programs, all at capacity and over capacity, but nowhere to place the students. So even if we went above our capacity, which some of our programs have gone above capacity, the problem becomes, where do we place them clinically?
And have we exhausted all of our opportunities of reaching out to the radiology groups in the state and the hospitals that, are they basically maxed out as well? Because you said it had to be 1-to-1.
Yeah, they are maxed out, but I do have, another possibility, and this could work for all of our professions, is, rather than, we're always looking at attracting new technologists, right? But we do have people that are in the field that have been there for a while. I believe that if we gave retention bonuses or retention incentives, that would also help for them to want to be able to stay in the profession longer, train new people longer. So that's the other end of things. So and that way we'll have more people that'll enter into the fields.
Oh, no, incentivize more faculty, basically, so we can get more.
Yeah, incentivize more, not faculty, more of the technologists. So the technologists, practitioners in the field.
Oh, and yeah, the one, what you're saying, the 1-to-1 hands-on experience, get more of the technologists wanting to do that. Right now, when we're talking about that 1-to-1, are we only talking about X-ray, or does that include CT and MRI?
So CT and MRI are a different animal, because those technologists are already technologists. So those that are entering the post-primary. So it's not necessarily a 1-to-1 unless they are not an entry-level radiographer first. So if, and there's not that many, there's no entry-level MRI in the state. Most of them are post-primary. So they would have to become a radiographer first. So we're taking them. So once they come into as a radiographer, most of the technologists are then expanding out into those advanced modalities, which is why we're not having as many. That's the other issue, is that you don't have as many X-ray techs now in doing just plain old radiography, because they've gone into CT, MRI, mammo, bone density, et cetera.
Where we also still have a shortage
Right,
there,
yeah.
so it's compounded. Yeah. Okay. Thanks.
You're welcome. So any other question or discussion? I think, Mr. Kidwell, I think that information that you will be able to provide about the vacancy rates will be very important to the conversations as we move forward. It'll help, I think, and I also believe that it'll give us a better picture as to what's going on in the state in all of their areas.
Yeah, and again, it's a little more specific than we went out and pulled first, so we'll do sort of resurvey everyone.
Okay, thank you.
We did get some response on, from the private groups. Linda is Kowalski's unavailable at the moment, but I will get what we have from her soon. But there frankly just aren't that many of us, the smaller, independent practices anymore, and so I think getting data from hospitals and larger systems will probably be more representative of the problem.
Perfect. Thank you, Dr. K. Go ahead, Ms. Griffiths.
So just some guidance for what the committee wants us to do. Obviously, we're going to get that the surveys that we're going to send out to hospital managers, directors. What other things should we be presenting for preparing to present to discuss next meeting rather?
Sure. I would like to, and I spoke with Mr. Green about this, was to come up with your top recommendations. It's not realistic for us to have 20, right, or even 10. So maybe 5 that would be worthy of presenting to the state as recommendations on how they might be able to support the shortage in our areas. Getting that sent out to or giving the list out to your stakeholders to find out what they feel is most important out of that list, and then focus in on that and provide that recommendation.
Okay, thank you.
You're welcome.
Do you think it's helpful? What I saw on hearing from Matt and hearing from you is there is overlap. I know the shortage for radiology technologists is a different cause, but there are overlap on some of what we think are solutions. When we're presenting for the January meeting, are we going to be presenting as a whole? Like, are the recommendations going to be, we think these recommendations will work for all 3 of these allied health professions? Or is it going to be, these are the ones for respiratory, these are the ones for radiology technology, and these are the ones for nuclear medicine? And I guess to add to that, if we think it's going to be as a whole, should we look at all of them and say, what works for everybody? What are the best ones that might help all 3 of these professions?
That's a great question. I think that I think it's, just for the sake of discussion and just being transparent for this committee, I feel as though we should do it separately and then have the discussion live during that meeting to determine what we feel is best for all the professions together, and to present that as a whole. So
the January meeting will be a live meeting where we're presenting, or is it something we write up and provide to them?
So the October meeting will be the recommendations bringing forward that we'll discuss and come up and hone in on what we need for each of our professions, or collectively, right, from the state.
Okay.
And the November meeting will be the draft.
Okay.
There will be the draft because we need to submit by January 1st.
Okay.
Final recommendations.
And that's where we have to decide, should we kind of combine them and present this as these 3 allied health fields, or do we say, no, we want to keep them separate and have these are the recommendations for each? Do we feel that one would help more than the other? If we join together, is that more powerful?
Yeah, and I think this is what this forum is for. So we can talk about that right now. We have time. I think about the rad techs that are in our field and the students that enter into our field wanting to become radiologic technologists, right? it's not for all of them, right? But wouldn't it be nice for them to know about respiratory therapists and that know about nuclear medicine to say, okay, so this might be the track for us. Maybe there's these other fields that we can enter into. And I have to be honest with you, Karen, I had no idea that there were that many schools in Connecticut that did respiratory care. So that was something that was interesting to me. And, since you brought it up the last meeting and several meetings before, it is something that sticks with me. So I think that is important. So if there's a way that we can bring together, you're at University of Hartford. So do you have collective fairs with your rad texts? So are there
Yeah, we have open houses for University of Hartford. It's all the health professions.
Okay.
Yeah.
Yeah. So I think, taking in, maybe having, like, you can add to your list, like having the high school counselors or the guidance counselors come to you as an open house, like, or inviting them for a breakfast and you can talk about respiratory therapy. So
And that's kind of what my ideas with HOSA are, because HOSA is the 31, the last I read, it was 31 chapters in the state of Connecticut that are students who are interested in health fields.
Mhm.
And when I was speaking, because I was involved last year at both the conferences, and speaking to the person who was running it last year, and quite honestly, I don't know if she's the one in charge this year. I haven't been able to find that on the website. But to connect with HOSA and have open it up to HOSA chapters. Yes, come to University of Hartford. We're going to do a fair that's not just respiratory therapy. It's respiratory therapy. It's nursing. It's all the other professions that we happen to have here. But to talk about all these different professions, I think that could be really valuable at the HOSA. And I have for the last 5 years gone to many hospitals, many career fairs. I spend a lot of time. I can't even, like, so many. And it's hard because they're not always that, sometimes you go and you're talking to a class that only has 10 people. Well, it's a lot of time. And none of us have that much time, right? We end up doing all our other work on the weekends because we're spending the time doing that. But it's a lot of time. So what I'm hoping that we can do, and maybe have state support. Like, as I think if we are going to do HOSA, I don't think there's enough support for HOSA, because from everything I heard there was a lot more chapters that wanted to go to both meetings last year, and they didn't have buses. There wasn't money for buses. To me, that's a low-hanging fruit, right? If you can get 3 times as many people to these meetings, and we can talk about these different professions, not just respiratory, but all the professions. To me, that's a low-hanging fruit, a little assistance with bus money, maybe someone who helps run the HOSA organization at that particular school district. So what I want to do is have kind of a big bang for the buck, not just this grassroots that I've been doing for five plus years, which really hasn't been all that effective. Right. And then when we go to these things, having assistance with marketing tools. I've been talking about for a long time, having a video that really promotes the profession. I've talked about it at the CHA meetings. Can we all get together and make one? I've seen ones from other states that are fantastic. We had one, but it's just plain too old to use. But each hospital says, well, we can't really afford it. We don't have the resources. But could we somehow combine resources? Maybe state help. Can someone come up with a really great video, 5 to 6 minute video that educates prospective students, whether it be high school students or whether it be at hospital career fairs for CNAs or people who want to advance? Can we have some kind of video that helps to promote this profession?
Right. I agree. I think that's what we all need. And I think, the pathways, I think that's great. That would work for everyone. I think, to include into your pathways, you also have those hospital transporters. So you have transporters, you've got that are clinical techs and PCAs. I think those are people that you could attract into your professions. So I think there's many ways, but they need the support. Again, it's all about the finances, right? So it is hard for someone to advance if they don't have the means or the support financially to be able to do so. I think that's what we run into a lot in Connecticut.
Yeah. Everyone has the best of intentions, but no one, like, the education programs are all tight. As you work in the education programs, the hospitals are all tight. Everyone wants this, and it's a vicious cycle, right? If everyone's so tight, like you said, they can't take the students. They know they need students, so they're not as busy, but they can't take them. So that's where I think we need the help, just to kind of break this cycle, get us the assistance, and get help that we can fill these positions so it's not as busy. And one of the things I think all of us have talked about is people leave the profession because the workloads are too high. Well, that's just adding to the problem again. So we need to kind of break that cycle. And I think that really support is what we need to help break that cycle.
Sure, it's the burnout and the toxic environment that results from the burnout that leads to that. Any other discussion? I know that we're having our own discussion, but does anybody else would like to participate?
Just as we think about the report, to the extent that there are recommendations that would require the legislature to do something, I would suggest we try to find areas that would be that all sort of our charge would be supported, rather than having to say, legislature, you need to do this for this group and that for that group. But just because we probably have one bite at the apple there, where we could sort of all do individually those things that you guys were talking about right on our own, thinking about how much time the legislature has to devote to any one thing. If we could find opportunities that are universal, I think that would be best.
Perfect. I think, I think that between the respiratory care practitioners and the radiologic technologists, our licensure is something that I think needs to be addressed. I know that it was addressed with nursing. There was an incentive that was provided there. Our initial license fee for a radiographer is $200, and then it's $105 annually. And I think for respiratory care, initial is $190, right? Does that sound right? So for and 105 as well. So I think that when we think about, we're trying to be sensitive and we want people to stay in the state, that's significantly higher than what other states are. I think it would be more in line with reducing that rate, even by a little bit. That initial fee initially would be, it would not make things as cost prohibitive to be able to work in Connecticut. Any thoughts on that, Mr. Green, Ms. Griffiths, or Mr. Raja?
Yeah, so I'm a nurse, so I know about the nursing licensing and how we're going to compact now. I just don't know much about the radiology or the RT licensing, if that is an option or out there, because I know that's a barrier to get people into the state or staying. To license in multiple states is cost prohibitive and challenging.
Thank you.
I agree, but I feel like I agree. I think once we get them into the programs and they graduate, they're going to pay that. They might not like it, but they're going to pay it. And the 105 each year, I don't personally think is outrageous. I think things like loan forgiveness and tuition assistance will go a lot further in getting more people into the programs, into the profession.
Okay. How about affordable housing? Have we thought about affordable housing, state support in providing housing?
Some of the comments we had from our hospital managers did address that, especially in some of the areas where they are really not able to attract respiratory therapists to those spots. I think it definitely could be something that can help attract people from out of state, respiratory therapists and other, obviously radiology technologists and nuclear medicine from other state. I think that could be something that would be helpful.
Yeah, I see the benefit. So I have sort of two lenses. I definitely see the benefit because I think it joins the chorus of other sort of other areas that say affordable housing is something that we need to address on a statewide level to retain individuals in the state. So I think it amplifies what is already being talked about. I wonder, as we think about the list of things that are particular to our focus, if we'll want to include affordable housing or not. Not because it's not important, but because other people, so we're trying to limit ourselves to say, you talked about maybe 5, a handful of things. I think we'll have to weigh the opportunity cost of one thing or the other, right? So I totally agree. I just, in the context of other things, we'll have to, I think, manage. So I see, the value in it in sort of both ways.
That makes a lot of sense. I agree with that. We'll have to have a discussion on that.
Yeah.
Thank you. So, talking further, are there any other points that anybody would like to make, or comments, suggestions, recommendations that were not brought up? Mr.
Can I
Cadwell?
just, sorry. The
I was just-
licensing,
oh,
it
go
just, there was like some I have to pull it back up in my memory, but last legislative session, there were at least 1 or 2 bills that dealt with licensing broadly and trying to cap both initial licenses and renewals for a variety of disciplines, not just in the healthcare field. I will try to resurrect that knowledge and information for our next discussion, but that is a ongoing discussion, not just in healthcare, but more broadly about what are we licensing, how much does it cost, those, all that.
Thank you.
The last thing I was going to suggest is just in anticipation of the next meeting, one thing that we can think about like individually is the suggestions that were made. If we are going to think about what we're going to overlap, I think we can think about also the distinction between things that are going to be can come from a legislative standpoint versus things that can come from a grassroots perspective or a grassroots movement. So that idea of a surplus of radiology students who may not be able to get into those programs initially, getting siphoned into a nuclear medicine or respiratory therapy program may not be something that the state needs to handle. That could just be something that our, state societies can work on together instead of the state having to do that. So that could just be one way to eliminate ideas that we're trying to put together as overlap.
Thank you. I love that idea. Any other thoughts or comments? Okay, yes, go ahead, Ms. Griffin.
Sorry, real quick. When do we expect to get the survey? I think this was you, Paul, the survey that you want us to send out.
So we would just survey our members. I don't think we need you to send it out. We'll send it out through the hospital association. And I'm anticipating that that'll go out early next week. We just have to load it into our system. But no, we don't. We would send it out to the members via our survey tool.
Okay.
Thank you.
And are we expecting to have a meeting in about 1 month from now? Is that the next meeting?
I did send out that doodle link last couple weeks ago, actually. I sent it out through Peter and Beverly. So I have one person who has responded back. I'm just waiting for everyone else. I can have them resend it out if you would like that.
Yes, I actually don't think I received that. If you could resend it out, that would be perfect. Thank you.
I will have them resend it out.
So we're looking at October.
We're looking at October.
Thank you.
Try to go. I have October 7th as the first date. Try to go further than that so that we have some time. So
Okay.
I have the entire month open right now. So just feel free to pick later dates so that we have more time to work on things. Okay. Any other discussion points or anything that you would like to bring up in relation to our task force and our charge? Okay, hearing nothing, I am going to ask if anybody would like to call to adjourn.
Motion to adjourn.
Okay, perfect. Seconded by Karen. Thank you so much, everyone. Please keep your eye out for that doodle poll for the next meeting and fill it out as soon as possible. Otherwise, I look forward to seeing you. If you need the minutes are on the CGA site under the Public Health Committee. So if you need to know what we've talked about, they are pretty good at posting them immediately. So feel free to go ahead and review those. Thank you, everyone. I look forward to connecting with you next month. Take care.
Thank you.
Thanks.